Recreating healthcare. Change can be challenging. Our healthcare system needs change. It needs recreation. Sometimes change, even for the better, can be challenging. The change we need may even seem absurd at first. In 1847, the Hungarian physician Ignaz Semmelweis presented a proposal that would dramatically change healthcare. The Hungarian physician, working in the maternity wards of Vienna General Hospital, was troubled by the high number of pregnant women coming to deliver a baby and then dying of puerperal fever. There were two maternity clinics at the hospital. The first clinic, a teaching service for medical students, and while the second was for the instruction of midwives. Semmelweis analyzed the puerperal fever death rates at each clinic, and he was troubled by the fact that the mortality rate was 2 to 5 times higher in the first clinic compared to the second clinic. Semmelweis explored and studied the problem extensively. When one of his colleagues, a pathologist, died, he researched the death and recognized that the pathologist died after pricking his finger while doing an autopsy on someone who had died from puerperal fever. The pathologist had died from puerperal fever as well. Semmelweis then recognized that not only maternity patients were dying from puerperal fever, but patients all over the hospital were dying from it. He realized that the key difference between the first and second maternity clinics was that in the first clinic, doctors were doing autopsies and then going to deliver babies, while the second clinic had just midwives who were delivering babies. Semmelweis hypothesized that there were particles from the dead patients that the doctors carried to the laboring mothers. He ordered his medical staff to clean their hands and instruments with soap and chlorine solution, a disinfectant. The puerperal fever rates diminished dramatically. His medical colleagues did not like what he had to say. They refused to accept his findings, not thinking they could have been part of the deaths of these patients. In fact, Semmelweis was ostracized, lost his job a year later, and died at the age of 47 in an asylum. It was 20 years later when the Scottish surgeon, Joseph Lister, who apparently had never heard of Semmelweis, elaborated the theory and the practice of antiseptic surgery. Hand washing seems obvious to us as a way to prevent infection, but because of the cultural beliefs and the science of the times, nobody but Semmelweis was able initially to see its benefit. Most saw it as absurd. Healthcare needs change. It needs recreation. Rather than following the herd off of a cliff, we must open our minds, our perspectives, to see what may even seem absurd as possible. Albert Einstein said, "If at first the idea is not absurd, then there is no hope for it." It's time to open our minds, to think beyond what we've always done to what may seem absurd to many, and begin to recreate healthcare. For more information and to share your ideas on recreating healthcare, go to www.recreatinghealthcare.net.